morning. My name is Dr. Todd Binkley. I'm a non-force chiropractor and clinical nutritionist. I grew up in Topeka, Kansas. I did my undergraduate training in biology and chemistry at the University of Kansas and at the med school at KU in Kansas City. And I did my graduate training at Palmer College of Chiropractic in Davenport, Iowa. I graduated from there in 1989 and came here almost immediately afterwards. So I've been in Ventura for 22 years. And so why should you refer your friends, your family, your neighbors, people that you love? Why would you trust me to take care of them? Well, 22 years experience is one reason. Other important reasons include the fact that whatever it is that you might send somebody to me for, I'm going to look for things that the other specialists that they might have gone to in the past won't even look for. Well, to find something, what do you have to do first? You have to look for it. Right, if you're not even looking for that thing, you're not going to find it. So for example, somebody that comes to me with plantar fasciitis or any other type of pain in their foot, one of the first things I'm going to look at is their calves. Why? Because short, tight calf muscles is the most common and the most overlooked cause of plantar fasciitis and almost any other pain in the foot. If you send somebody to me with a knee issue, a torn meniscus, an old injury in a knee that won't heal, one of the first things I'm going to look at is their hip rotators. Why? Because the knee only likes to bend in one direction. If it's twisted, it wears out. The most common thing that causes your knee to be twisted and overloaded in a torsion type direction all the time is tight hip rotator muscles. The hip rotators get tight just from sitting all the time. Does anybody here do much of that? Yeah, and people wonder why their knees just suddenly go out when they didn't really do anything. If you send somebody to me with low back pain, one of the first things I'm going to look at right after I look at their low back is their psoas muscles in their abdomen and their hamstrings and their quadriceps. Why? Because the most common short, tight muscles that overload joints in the low back are the psoas and the quadriceps and the hamstrings. And when you stretch and loosen those muscles and keep them long and loose, back pain heals. Disc herniations that are scheduled for surgery, when they do that and a few other things that I do with people in the office, heal so that you don't need the surgery. People that have had surgery and can't get a traditional chiropractic adjustment on that area anymore because of scar tissue or a vulnerability in that tissue because of the injury can still get non-force chiropractic, can still stretch the short, tight muscles that are overloading that damaged tissue that's not healing, which will cause the inflammation in that tissue to go down, which will eliminate the pain and restore enough function that you can function without pain. If you send somebody to me with a neck ache, one of the first things I'm going to look at after looking at their neck is their upper back, because the foundation of the cervical spine, the neck, is the upper back. Right after that, I'm going to look for tension in their pec muscles, because short, tight pec muscles keep your shoulders stuck like this all the time, and that directly aggravates almost all neck conditions. If you send somebody to me with headaches, like migraines that they've had for a long time, I'm going to do what I do on every patient, which is check for spinal cord tension. Your brain and your spinal cord, which control everything in your body, are about the consistency of Jell-O. So they're very delicate. If you could reach it, you could easily just pinch the spinal cord right off with your fingertips. So it's very well protected. It's surrounded by bone, the skull for the brain, and the spinal column is essentially a tube of bone cut up into 24 segments like a stack of bagels with the spinal cord running down the center. That bone protects that delicate tissue. In addition to that bone, you also have a fluid-filled sac called the meninges, which is kind of like a water balloon up in the skull, filled with fluid surrounding the brain that runs all the way down to the tailbone, protecting and acting like a cushion for the brain and the spinal cord. Tension builds up on that membrane from any kind of stress you can name, mental, emotional, physical. When you think of something, quote unquote, getting on your nerves, mechanical tension literally builds up on that membrane, and it can be released with a specific type of non-force adjustment. There's no force because the point of the adjustment is to alert your brain to the presence of tension on that membrane at both ends of the spine. When your brain can figure out exactly where that tension is built up and realize that it doesn't need to be there, it will use your muscles to release it automatically. It's trying to do that all the time anyway. But the stress over time impairs the mechanism that your body uses to ongoingly deal with stress. And it can always be restored as long as you're still breathing. So those are some of the things that I do physically for people. On the nutrition side, clinical nutrition means I use standard medical lab tests, blood tests, heavy metal tests, tests for hormones, tests for neurotransmitters, tests for parasites in the gut, but I use those tests in a different way. When you go to a physician, he's going to use the standard medical lab ranges when he does any test on you. So these are broad ranges to see if you're bad enough to need medical care today. So if you're outside of a certain range, he'll prescribe some kind of medicine or follow-up testing or other type of medical care today. If you're just inside those ranges, he'll tell you you're fine, which is a lie. Because most people interpret that to mean that they're healthy. And health is not just inside those boundaries. Because people that are just inside those boundaries drop dead all of the time. They drop dead of heart attacks. They get told they have cancer and they have 3 to 6 months to live. But they were just inside those boundaries the last time they got their physical exam. I had a guy that came into me with a GERD, and we ran labs on him, and he had leukemia. He went and got his physical 6 months before and told him he was fine. So I got to find that for him. We caught it early enough. He obviously needed, I sent him to a hematologist. He needed some very specific medication for that. But we got it early enough that he's in remission now. So you never know what you don't know. It's why it's a really good idea to get your blood tested if you're not going routinely to get a physical, to get it tested somewhere just to get a screen. But when you come to me, I also do a different type of analysis. So instead of just using the broad medical ranges, I use a more narrowly focused health range that's been determined by practitioners that look for and restore health in people, like myself, like naturopaths, like functional medicine physicians, certain endocrinologists, people that are a little more progressive, use this, have developed and use this range, because we know if we get your lab ranges in this narrow range, then you get rid of the symptoms that you have and you stay healthy over time. So for example, somebody comes to me with low energy. That's one of the most common complaints people come to me for nutrition. Well, that's never a single cause thing. It could be you might be borderline anemic. You might be borderline low thyroid. You might have B vitamin deficiencies. You might have a chronic infection in your sinuses or in your gut that you don't know about because it's a chronic infection, not an acute infection. So acute infections are the ones we're familiar with, where you have a runny nose, a cough, a fever, increased white blood cells on your blood panel. When you have a chronic infection, your white blood cell count goes down. Well, if your white cell count is low, most physicians just consider that a normal variant. Why it's really low, if you have a chronic infection, is because your immune system is not keeping up with production of white blood cells, because it's always on this, trying to fight off this low-grade infection. When you get rid of that, you get your energy back, your immune system improves. Sometimes just doing something as simple, you've heard me say it several times before, as repleting your vitamin D levels. That means restoring the normal, healthy range of vitamin D in your bloodstream can eliminate low energy and a chronic infection and prevent colds and futures forever. Most of the people I test, if they're not taking 5,000 units, not 1,000, not the RDA of 400, but 5,000 units of vitamin D a day, then their blood levels come back at like 15 or 20. And we now know that the healthy range is between 60 and 80. So I've got 2 minutes left. Do you have any questions about nutrition or physical? David.
I'd like people to know a little bit about, maybe you have a little yoga corner in your office for people that like yoga, and you can show them poses that they can use at home.
Sure. Sure. Great question. So the question was about the yoga and the yoga equipment that I use in my office. So anybody that comes into me for physical complaints, neck ache, backache, knee, hip, shoulder, that sort of thing, once I do the restoration, get the tissue or get the tension relieved as best we can in the office, even before I'm finished with that, almost immediately I start people on stretches, which are mostly Iyengar-based, alignment-based yoga stretches and poses, so that you can relieve short, tight muscles in your body and keep them that way. So you can go and sit and never stretch and come to me, get everything released, and then go back to doing what you're doing and just sit all day and never stretch, and those problems will recur over time. Not immediately, but over time. If you do the stretches that I give you, then you can retain those changes forever. Okay, I think my time is up. Thank you very much.